good. The annual report on the condition of children in Orange County is out. Provides a comprehensive picture of the present condition of children in Orange County. Here with the results of this, the 14th annual report, we are joined by Chief Deputy Director of Social Services, Michael Riley, and Dr. Kurt Condon from the Orange County Healthcare Agency. We're glad to have you both with us today.
Thank you.
Yeah, thanks for coming on. Okay, as I said, this is the 14th report.
Yes, it is.
You guys have been at this for quite a number of years. Let's just go back a little bit. How and why did this report get started?
We started this report in 1994 when the Children's Services Coordinating Council was begun in the early 90s. We were looking at a comprehensive approach of what's happening with our children in Orange County. We wanted to look at everything from health care to safe and stable communities, and how is that impacting our kids in Orange County, and what kinds of things can we do to intervene once we do discover these kinds of whatever the findings we have come across.
Okay, that's my next question. Once you are done with the report, then whose hands does it get into, and what help does it do?
It goes in. You would be surprised how many universities and nonprofit agencies out there in the community use this document to write grants. It's broken up into 4 parts. It's looking at, for example, educational achievement, good health, what we call safe homes and safe communities, as well as health care, general health care.
Just in general.
And economic well-being in general. And it's broken up into 39 indicators. And it looks at all kinds of factors as to what, and it looks at them longitudinally. So we're not looking at just one point in time, looking at about a 10-year period of time.
Over a period. Now, Kurt, your main focus in this report is the substance abuse portion of this report in regards to prenatal care and that type of thing. What type of finding did you get from this?
Right. The special section this year focused on substance-exposed babies. And so in 2007, the county embarked on a study to get the most recent prevalence data for prenatal exposure to alcohol, tobacco, or drugs. And what we found was quite surprising, that about 15% of women report or are found to have used alcohol, tobacco, or drugs sometime during their pregnancy.
15%. Okay.
Which equates to roughly 6,800 babies born every year in Orange County that have been exposed to the detrimental effects of those substances.
Okay. The difference between babies who have been exposed to those things and babies who are affected in a major way, do you also have results from that? Babies who are born addicted to crack or have, fetal alcohol syndrome?
The study really was focusing on some major outcomes, birth outcomes, in terms of women who use substances are more likely to have a premature birth or a low birth weight baby. We didn't actually look at any other findings in terms of the outcomes, but we do know from other research that alcohol, tobacco, and drugs can have profound effects on children's cognitive abilities, their developmental, language acquisition, and also their social behavior as they grow into adulthood.
Now, Michael, in the 14-year study that's gone on, when you look at sort of the rise and fall of trends, what do you see in this study that is standing out for you?
Generally speaking, the trends are positive in regards to the kinds of services we put in place in Orange County over the last 14 years or so. We have been very proactive in regards to doing a much more outreach to mitigate the risk factors that many of our low-income families may be faced with, as well as our middle-class families. And I think it's important to note, as Curtis has said, that when we talk about babies who are born with substance abuse issues, it has a lifelong impact on them. And children oftentimes who are born in these circumstances are more likely to end up in the criminal justice system and obviously be low achievers in our academic setting. So it's important that we identify these issues much early on.
If folks want to get a copy of this report, is that available to the general public?
Yes, it is, and you can get it online as well. And I don't have the online address, but you can go on the Orange County website, and I believe there's a link there you can just navigate to and download a copy.
Download a copy of it. It's very interesting. Thank you so much for coming back, Kurt. It was nice to have you on.
Thank you.
All right, thanks a lot.
I'm sure budget cuts are not helping a whole lot, and of course the slowing